Today we are going to look at Unit 3, where we are going to discuss about the classification and management of psychiatric disorders. Okay, so let's now look at the introduction to classification and management of psychiatric disorders. So mental disorders can be broadly classified into two. The disorders can be either be minor, which is neurotic, or major, which is psychosis. So major mental disorders or psychoses are further divided into two: functional psychosis and organic psychosis. So let's now look at the functional psychoses. So these are major mental disorders with no demonstrable physical cause, while organic psychoses are major mental disorders with demonstrable physical causes. So below is the diagram showing the mental disorder classification. So we have minor, which is neurosis, and major, which is psychosis, which is divided into two, which is functional psychosis with no physical cause, while organic psychosis with physical causes. Okay, so let's now focus on the psychosis part. So psychosis refers to broadly to severe form of mental disorders such as organic mental disorders, schizophrenia, then affective disorders. So those are the examples of psychoses. Now let's look at the classification of characteristics of psychoses. So there are greater severity, patient lack of insight, then patient inability to distinguish between objective experience and reality. So for example, hallucination and delusion. So that is on the part of psychosis, be it functional or um, organic. Yes. So let's now look at neurosis. So neurosis refers to mental disorders that are generally less severe than psychosis. Their characteristic symptoms are closer to normal. Then they experience anxieties. Yes, so that is neurosis. We said it refers to mental disorders that are generally less severe than psychosis. So examples of this neurosis is anxiety. Is it clear? So neurosis is further classified into anxiety disorder, obsessive compulsive neurosis, and somatoform disorders. So that is how neurosis is classified. So let's now look at neurosis slash anxiety disorders. So category of mental disorders in which the symptoms are distressing to the person. So reality testing is intact. Behavior does not violate gross social norms and there is no apparent organic cause. So there are no causes. So anxiety disorders are characterized by exaggerated and often disabling anxiety reaction. So anxiety is usually considered a normal reaction to realistic danger or threats to biological integrity or self concept. So normal anxiety disorder when the danger or threat is no longer present. Okay, so it is difficult to draw a precise line between normal and abnormal anxiety because it occurs on a continuum from mild to moderate, severe, and then panic levels. Yes. So what is anxiety? So anxiety is a physical or emotional distress which interfere with normal life. Okay. So let's now look at the responses of anxiety. So number one, we're saying flight or fight response. So prepare the body for reaction. Then sympathetic fiber increase the vital signs. So blood pressure increases, temperature rise, pulse increases, respiration rate increases. Is it okay? Then adrenal gland release adrenaline, which causes the body to take in more oxygen, dilate the pupil, brings more light into the eyes for better vision. Then increase the arterial blood pressure and heart rate. Then constrict peripheral vessels, makes skin cool and pale. Then increase glycogenolysis to free glucose for fuel. So glycogen is being broken down into the liver. Okay. Then anxiety is distinguished from fear, which is feeling afraid or threatened by a clearly unidentifiable external stimuli that expresses danger to the person. Okay, so let's now look at the types of anxiety. So number one, we are saying we have generalized anxiety disorder. Then number two, we have post-traumatic stress disorder. Then we have obsessive compulsive disorder. We have also panic disorder and phobia. So for today, we are going to end on the types of anxiety. So the next presentation, we are going to look at these type one by one. So we are going to start with generalized anxiety disorder. So don't miss the next presentation. Thank you.